busy shift, a nurse loads medication and asks you to administer it. What is your action? Option A. Ask a student nurse to help you administer medication. Option B. Ask another staff nurse to help you with administering medication. Option C. Accept to administer the medication. Option D. Refuse to administer the medication. Correct answer is D. Refuse to administer the medication because you don't know what medication the other nurse loaded and you don't know the dose, route, all those things, all the prescriptions. So you cannot administer the medications. You have to refuse to administer the medication. A patient with burns is given anesthesia using 50% oxygen and 50% nitrous oxide to reduce pain during dressing. How long this gas is to be inhaled to be more effective? Option A, 30 seconds. Option B, 60 seconds. Option C, 1 to 2 minutes. Option D, 3 to 5 minutes. The answer is C, 1 to 2 minutes. You are caring for a patient in isolation with suspected Clostridium difficile. What are the essential key actions to prevent the spread of infection? Option A. Regular hand hygiene and the promotion of infection prevention link nurse role. Option B. Encourage the doctor to wear gloves and the apron to be bared below the elbow and to wash hands with alcohol hand rub. Ask for cleaning to be increased with soap-based product. Option C. Ask the infection prevention team to review the patient medication chart and provide regular teaching session on the 5 moments of hand hygiene. Provide the patient and family with adequate information. Option D. Review antimicrobial daily. Wash hand with soap and water before and after each contact with the patient. Ask for enhanced cleaning with the chlorine-based product and use glove and apron when disposing of body fluids. The correct answer is D. Review antimicrobial daily. Wash hand with soap and water before and after each contact with the patient. Ask for enhanced cleaning with chlorine-based products and use gloves and apron when disposing of body fluids. All of the staff nurses on duty noticed that a newly hired staff nurse has been selective of her task. All of them thought that she has a limited knowledge of the procedures. What should the manager do in these situations? Option A. Reprimand the new staff nurse in front of everyone that what she is doing is unacceptable. Option B. Call the new nurse and talk to her privately. Ask how the manager can be of help to improve her situation. Option C. Ignore the incident and just continue with what she was doing. Option D. Assign someone to guide the new staff nurse until she is competent in doing her task. Answer is B. Call the new nurse and talk to her privately. Ask how the manager can be of help to improve her situation. Why is it essential to humidify oxygen used during respiratory therapy? Option A. Oxygen is a very hot gas, so if humidification is done to you, the oxygen will burn the respiratory tract and cause considerable pain for the patient when they breathe. Option B. Oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airway, reduction of the movement of cilia, and increased susceptibility to respiratory infection. Option C. Humidification cleans the oxygen as it is administered to ensure it is free from any aerobic pathogen before it is inhaled by the patient. Option D. Humidification oxygen adds hydrogen to it, which make it easier for oxygen to be absorbed to the blood in the lungs. This means the cells that need it for intracellular function have their needs met in a more timely manner. Answer is B. Oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airway, reduction of the movement of cilia, and increased susceptibility to respiratory infection. You can delegate medication administration to a student if option A. The student was assessed as competent. Option B. Only under close and direct supervision. Option C. The patient has only oral medication. Answer is B. So the student can only administer medication under close and direct supervision. John, 25 years old, was admitted to medical assessment unit because of a urine infection. During your assessment, he was using cannabis under prescription for his migraine and still has some in his bag. What is your best reply to him about cannabis? Option A. Cannabis is a Class C drug under the UK Misuse of Drug Act 1971. Option B. A custodial sentence of 20 days is now given to anyone in possession 3 times or more. Option C. Cannabis is a Class B drug under the UK Misuse of Drug Act 1971. Option D. Possession of cannabis will incur a penalty of 3 months imprisonment with the £2,000 fine. Correct answer is C. Cannabis is a Class B drug under the UK Misuse of Drugs Act 1971. One busy day on your shift, a manager told you that all washes should be done by 10 a.m. What would you do? Option A. Follow the manager and ensure that everything is done on time. Option B. Talk to the manager and tell her that quality of care will be compromised if washes are rushed. Option C. Ignore the manager and just continue with what you are doing. Option D. Provide a written statement of the incident. Answer is B. Talk to the manager and tell her that quality of care will be compromised if washes are rushed. What do you have to consider if you are obtaining consent from the patient? Option A. An understanding. Option B. Capacity. Option C. Intellect. Option D. Patient condition. Answer is B. Capacity. So whenever you are obtaining consent from the patient, you have to consider mental capacity of patient to give consent. Recommended pre-operative fasting time are option A 2 to 4 hours, option B 6 to 12 hours, option C 12 to 14 hours. The correct answer is B 6 to 12 hours. A nurse is not allowing the client to go to bed without finishing her meal. What is your action as a registered nurse? Option A. Do nothing as the client has to finish her meal, which is important for her health. Option B. Challenge the situation immediately as this is related to the dignity of the patient and raise your concern. Option C. Do nothing as the patient is not under your care. Option D. Wait until the situation is over and speak to the client about what she wants to do. The correct answer is B. Challenge the situation immediately as this is related to the dignity of the patient and raise your concern. A client expressed concern regarding the confidentiality of her medical information. The nurse assured the client that the nurse maintained client confidentiality by option A. Sharing the information with all members of healthcare team. Option B. Limiting discussion about client to the group room and hallways. Option C. Summarizing the information the client provides during assessment and documenting this summary in the chart. Option D. Explaining the exact limits of confidentiality in the exchange between the client and the nurse. The correct answer is D. Explaining the exact limits of confidentiality in the exchange between the client and the nurse. A patient on your ward complains that her heart is racing and you find that the pulse is too fast to manually palpate. What would your action be? Option A. Shout for help and run to collect the crashed trolley. Option B. Ask the patient to calm down and check her most recent sets of blood and the fluid balance. Option C. A full set of observations: blood pressure, respiratory rate, oxygen saturation and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. Option D. Check baseline observation and refer to the cardiology team. The answer is a C. A full sets of observation: blood pressure, respiratory rate, oxygen saturation, and temperature. It is essential to perform a 12-lead ECG. The patient should be then be reviewed by the doctor. Consent is best defined as option A. Obtaining consent is a process and is one of event. Option B. Valid consent must be given by a competent person who may be person lawfully appointed on behalf of the person and must be voluntarily. Option C. Another person can give consent to an adult who has capacity to consent. Option D. The assessment as to whether an adult lacks the capacity to consent or not is primarily done to the clinician providing the treatment or care, but nurses and midwives has no responsibility to participate in discussions about this assessment. The correct answer is B. Valid consent must be given by a competent person who may be a person lawfully appointed on behalf of the person and must be given voluntarily. One of your patients in a Bay 1 is having episode of vomiting for the last 2 days now. The norovirus alert has been enforced. The other patient look concerned that he may spread the infection. What is your next action in this situation? Option A. Seek the infection control nurse advice regarding isolation. Option B. Give the patient an antiemetic to control the vomiting. Option C. Offer the patient a lot of drinks to rehydrate. Option D. Tell the other patient that vomiting will not cause infection in others. Answer is A. Seek the infection control nurse advice regarding isolation. Mr. Jones' carer approach you to express their dissatisfaction with the care he is receiving while still under your care. How will you best approach this situation? Option A. Explain to them that evidence should be made explicit to move the case forward. Option B. Tell them to put their complaint forward to the nurse in charge or sister of the ward. Option C. Advise them to speak to the police if case needs to be filed. Option D. Apologize to them and reassure them that their concern will be dealt with in accordance to the policy. Answer is D. Apologize to them and reassure them that their concerns will be dealt with in accordance to policy. Mental Capacity Act 2005 explore which of the following concept? Option A. Mental capacity, advanced treatment decision and the Act's code of practice. Option B. Mental capacity, independent mental capacity advocates and the Act's codes of practice. Option C. Mental capacity, advanced treatment decision, independent mental capacity advocate and Act's codes of practice. Option D. Mental capacity and the possible ethical and legal dilemma in its interpretation. The correct answer is C. Mental capacity, advanced treatment decision, independent mental capacity advocate and Act code of practice. As a nurse, you are responsible for looking after patient nutritional need and maintaining good weight during hospitalization. How would you achieve this? Option A. Providing all clients with liquid nutritional supplement. Option B. Assessing all patients using the MOST screening tool and by taking patient preference into consideration. Option C, checking daily weight and documenting. Option D, assessing nutritional status, client preference and needs, making individual food choice available, checking daily weight and documentation. Answer is B, assessing all patients using the MUST screening tool and by taking patient preference into consideration. When delegating any tasks to anyone, what must you consider? Option A, delegating according to the job description. Option B, delegating tasks to student nurses they can be able to do. Option C, delegating tasks only to healthcare assistant. Option D, before delegating tasks to anyone, have to make sure that person is competent and able to carry the task. The correct answer is D, before delegating tasks to anyone, have to make sure that person is competent and able to carry the task. Gurgling sounds from the airway in a post-operative client indicate what? Option A, complete obstruction of lower airway. Option B, partial obstruction of upper airway. Option C, common sign of a post-operative patient. Option D, indicate immediate insertion of laryngeal airway. The answer is B, partial obstruction of the upper airway. Thank you for watching. Please like my video and please subscribe to my channel. Press the bell icon to get more video.